This is our patient, Sir Hurts-a-Lot. He is a patient with severe dental anxiety, high stress, and suffers from chronic dry mouth due to his stress, and that as a result also has rampant caries. Due to our patient being very high stress and dental phobic, they believe brushing as hard as they can will prevent dental caries and will replace a professional dental cleaning. This has led our patient to develop severe gingival recession on his posterior teeth, buccal, top, and bottom, due to scrub brushing. For these areas of recession, a Stillman's technique can be demonstrated. Alright, Sir Hurts-a-Lot, I am going to tell you about 2 brushing methods that could greatly benefit you. The first method is called Stillman's, and it is indicated for patients such as yourself with gingival recession. Let me show you. You hold the bristles of your toothbrush angled towards the gum line. Part of the bristles are placed on the neck of the tooth and on part of the gum. Now, with light pressure, you're going to use a short back and forth vibratory stroke like so. Another way to prevent from scrub brushing is either using your non-dominant hand to brush your teeth or only using 3 fingers, which will prevent you from using too much pressure. Now, since your front teeth have no visible recession, you can use Bass brushing method. It is very similar to the angle of the Stillman's method, except you keep the bristles on the tooth, on more of the tooth and under the gums to promote sulcular cleansing and maintain good periodontal health. Then you can utilize some gentle but still firm vibratory strokes like so. It is also important to remember to cleanse the tongue as well. This will reduce oral malodor and reduces the number of microorganisms in your mouth. You can use a toothbrush, but I personally recommend using a metal tongue scraper to reduce the amount of bacteria buildup on your toothbrush. Make sure not to scrape the tongue vigorously and instead make gentle but firm passes on the tongue like so. Sir Hurts-a-Lot also struggles from chronic dry mouth due to being under constant stress. This, in combination with an anxious avoidance of the dentist, has led our patient to develop rampant caries. In the meantime, while our patient waits for his next appointment with the dentist to treat the cavities, we can recommend a dentifrice that has antimicrobial properties, such as chlorhexidine or triclosan, to reduce biofilm and control plaque. A mouth rinse can also aid in the remineralization of potential incipient caries, if it contains fluorides such as sodium fluoride. The dry mouth formula from the brand Act also has ingredients such as glycerin and xylitol, which aids in the dry mouth the patient experiences and in the malodor that results from it. As for recommended devices, to our patient Sir Hurts-a-Lot, I would encourage him to invest in an electric toothbrush that warns when too much pressure is being applied. This will prevent our patient from scrub brushing and causing much more gingival recession than necessary. Now, since our patient is a scrub brusher and has also caused a loss of papilla, as a result, his papilla is blunted with a type 2 embrasure spaces around the maxillary premolars. Talking to our patient, I would say, hey, due to the larger spaces in between your teeth and due to the natural shape of the teeth involved, aka the mesial root concavity on the first premolar, I would suggest using an interproximal brush in order to clean in between the spaces. You would take the brush and insert it interproximally in between the teeth in order to clean in between the spaces. This way, the bristles reach all the hard-to-reach places that the floss might not reach.